Hello, my name is Henning Kalwa. I'm the founder and CEO of ImagineHealth and the regional director for Temos International in Asia. Today, I'm very pleased to be here with Dr. Claudia Mika, the founder and CEO of Temos International. And the reason we're speaking today is June is the International Awareness Month for fertility. So the topic of today is fertility and ways to find a good fertility provider. Welcome to our call today, Claudia.
Thank you very much, Henning. A pleasure to be with you today.
Likewise. Yep, so let's dive right into it. In your opinion, why do couples decide to travel for fertility options?
There are different reasons depending on the country where the couple lives. So one for sure we all know is regarding the costs, so that couples cannot afford treatment in their own country and try to find solutions abroad. But there are other reasons. There may be the reason of quality, that they think or heard that the quality in your own country, because of a lack of experience, for example, a lack of experts, that the quality in their own country is not sufficient or doesn't meet their expectations, so they're looking for other solutions abroad. And another reason is that it may be that there are long waiting times, or that the treatment they are looking for, and we have, as we all know, a large variety of fertility treatments available nowadays, that the treatment they are looking for or they need for their conditions is not available in their own country, so that they need to go to another country to have the chance to become parents in the end.
Right. As you know, I'm based in Bangkok, Thailand, and in Bangkok alone, we have 200 IVF treatment providers. 200.
Yeah.
So I can assume, and I know it's quite challenging and at times confusing for such parents to find the right choice or to make the right choice, right? So is there any way to navigate this truly confusing marketplace?
Yeah, that's a very good and important question. Definitely, it's a challenge nowadays because many clinics do advertisements which may not be ethical. So it's really difficult to find a good solution for, and this is the first tip I would give, to really sit down and think about what do we need and what do we want. It's a very sensitive topic. It's a very ethical thing. So there are different questions the couples should ask themselves and should look for. One thing is, how is the communication with the clinic? Do I have a contact person? Do I communicate only with a chat box? Do I have a real human being answering my questions? How long does it take to get the answers to my questions? How is the information provision via social media? Is there a website? How is the website structured? What is the information provided? Are the experts displayed with the CVs? Do I know who is behind the clinic? How are the success rates? And this is a very tricky point, which I may get back in a minute just to go to this topic again. Communication is crucial. Expertise is crucial. Does the laboratory have high qualified embryologists? Because in reproductive care treatments, there is also the laboratory has a very important role. But back to the success rates. Many clinics nowadays, because they know that they should publish the success rates, publish success rates. But it's very difficult to find out if this is based on the pregnancy rate from the laboratory. Is this because considering the frozen embryos, fresh embryos, cycles, age? So this is difficult for couples to find out and to understand. And this should be explained them by the clinic. Exactly, our success rates mean this and that. Our benchmark is this and that. We compare ourselves to ESTRA, for example. This is the European association. Then we have also the American association. So, and then if this is all answered and the couple feels good with the answer and also with the treatment plan, with the cost, with the quality, then they should be comfortable and then they can decide or should decide for something like this. So quality is a very crucial point here from the embryo or from the treatment itself, and should be considered. And of course, then accreditation can help. And there will be a label published on the website, the certificate, and this can help couples also to decide where to go.
Well, excellent. Well, you just mentioned the, the accreditation. So please explain to our viewers a little bit about Temos International Accreditation, what it stands for, what its vision is, and how it could potentially help IVF shoppers in that sense to find the right and trusted provider.
Yeah, Temos International is an international accreditation body. We have tailored accreditation programs for different healthcare organizations, so for hospitals and clinics. And one of the programs we offer is accreditation for reproductive care clinics. And we have up to 500 standards for the reproductive care programs. And we check really from up to down, from left to right, a fertility clinic and the services, including, and this is really unique in fertility accreditation, that we include the laboratory, the art, as we call art laboratory, we include this into our accreditation program. So we not only check the clinic or the laboratory, because both parts are available for certification accreditation, we included both. And one important thing also is that we always have an embryologist with us during the assessment process. So we check the quality, we check everything, documentation, processes, the infection control, hygiene, the communication, everything around patient experience is checked. But one important part is also the, let's say, technical, scientific part, which is then to check the laboratory regarding the capabilities, the technical infrastructure, and the quality and outcome.
Well, excellent. So I think that takes away much of the guesswork of such international travelers considering to go abroad. One could look out for that that seal of approval, so to speak, and be rest assured that at least, you know, all these topics you just mentioned, they are covered and frequently reviewed. And then maybe it's just a matter of, do I connect with the physician? Do I have a nice, do I have a nice communication with the customer service, as you mentioned? Excellent. That's a very excellent initiative. So I see these benefits from a buyer's point of view, and then from a provider's point of view. What are the benefits if a provider decides to pursue a Temos accreditation?
Yeah, first of all, it's a neutral inspection and a neutral check of the quality of the processes. Accreditation in most of the cases is voluntary. So if a healthcare provider decides to go for it, this is a decision which is done voluntary. And if I do, we are all the same. If I decide for something voluntarily, I want to add value to my organization. I want to see benefits. Benefits are that we check all the processes, so we may help to make the processes more effective, more efficient, and with this even help to save money in the end. Another thing is that we check the qualification of the staff, and we may find out together that further qualification is needed to optimize the services and to increase the patient experience regarding communication, regarding technical aspects. Then we check if everything is regarding the infection control in place, or is there potential for improvement. Accreditation is always, independent from the unit or the department we visit and we meet, we check, is always regarding quality improvement, to optimize services, to make it more efficient, save money, give the patients an added value, and have this certified, or in our case accredited, stamped, as you said, as a seal of trust from a neutral, independent organization.
Right. And I assume, again, coming back to Bangkok, if you know that there are 200 other clinics similar to yourself, it's a really nice way to set yourself apart and stand out in a very crowded marketplace for the right reasons, that is.
Yes, I agree.
Okay, so are there any other accreditation programs similar to yours? And if not, what sets it apart?
As far as I know, there is no accreditation body that is offering a similar program as we do. What I mentioned before is that what is unique is that we combine the clinic processes and the laboratory. And this is not in my knowledge. And if somebody knows it differently, so I would be very happy to learn about it. But from my knowledge, it's not available. So this is a unique program with unique standards, which are based on the standards we also use for hospitals and clinics and other healthcare organizations. And we combine those general applicable standards with specific standards in reproductive care. The laboratory is one thing, but the experience and the knowledge of the experts, the doctors, the embryologists, the nurses, and all other staff is carefully checked, and we have requirements for the different levels of embryologists, for example, who should guide and lead such a clinic, who should lead and be the head of the embryologist, who is the head of the laboratory. So we have clear definitions and clear requirements for this in our accreditation program. In the end, to assure that all patients are safe during the complete patient journey for reproductive care, from the first contact to the follow-up. So we even require follow-ups for the clinics to assure that the patients are safe and doing well, even if it doesn't work out and the success is not there as wished, even if it's disappointing, even then it's even more important to follow up and to take care of the couples to assure that they are doing well.
Excellent. It's great to hear that with Temos, patient safety is paramount and that there are no shortcuts. And for providers, it's the right way to go to really have that mindset in the organization, right?
Absolutely.
Quality assurance is a mindset. It's not a symbol. So most likely this video is being watched also by providers and their leadership and directors. So maybe if you could explain the accreditation process for IVF clinics, what does that look like? What does it entail? What's the timeline? Just the rough framework, please.
Mm-hmm. Yeah, as we said before, it's a voluntary program. So it's free to apply, and this would be the first step. We have on our website, temosinternational.com, there is a registration form, the application form, which should be filled out. This is free of charge. Since we are a German-based accreditation body, we fulfill the European requirements regarding data protection and confidentiality. So the data are safe, and this is the first step to apply. We will see the application, we will respond and provide a quotation. If the quotation is accepted, then we are going to start the process. We do have our own online tools. All providers, all clinics would get an individual account to the own system, and then we have a self-evaluation and we have a questionnaire which has to be filled out as part of the preparation. We provide, of course, the standards, we provide further guidance. We also have an online meeting to explain the procedure and the process in detail by our customer care team. And once the preparation has been completed, then a team will visit the clinic for 2 to 4 days and check everything what was prepared, was implemented, checks it on site. We do not do any virtual assessment. We always send a team to the clinic because we are convinced that the clinic has to be seen. You have to look around, you have to hear, you have to speak, you have to see everything. And this is a very important part of our process. Once this on-site visit has been completed, there will be a final report. This final report is to be approved by our medical board. And if the accreditation decision is positive, then the organization will receive the accreditation award, the certificate, and then we will follow up on an annual basis to keep in touch. And after 3 years, the process has to be renewed and the reaccreditation has to be started.
Excellent. Well, you just mentioned it briefly, keeping in touch. I wonder, do providers receive any resources or support from Temos prior, during, and after the accreditation, right? That's my feedback from the ground. Often providers feel a little bit left alone once the accreditation is successful. What does Temos do differently?
Yeah. So what we do, for us, it's very important to accompany the organization during the complete preparation. So as part of our, so to say, package for the accreditation fee, we are available via email, via phone, via online meetings to guide. So whenever there are questions, they can just put them in the email and we will respond within 48 hours. We will consult our assessors to get their expertise and their answers to this. We are available for education and training if this is wished, because we know, and this is why we do all this, that accreditation language, although it's English to English, but the accreditation language uses a specific vocabulary. And therefore we have a huge interest to have the experience during the preparation and during the on-site visit, a good one, not only for the clinic, but also for our assessors. So they are also frustrated if they see in the end that the preparation was not done properly, and it's frustration and disappointment on both sides. So we try to avoid this by being at the site of the clinic, by support, training, education, and answering questions. Afterwards, that was the second part of your question regarding the availability. We don't stop being available. So if for the progress report, which has to be submitted after the on-site visit, based on the findings our assessor team have, then the organization has to submit a progress report. And we, again, are available for answers there. If they don't know how to fill out the respective parts of the progress report. On an annual basis, we send an online questionnaire and ask for an update of data regarding infection control, success rate, outcome, and others. And again, if there is anything to be shared, we are available. We have a customer care team who will be the individual contact person for the clinic, and therefore we are always available and the contact details are known to the clinic.
Excellent. So how can potential providers, but also perhaps parents, find you and Temos and share their questions and perhaps applications? Do you have social media channels and the like, please?
Yeah, so we have a website for sure, and the website has the registration form, which is on the very easily to be found. If you just go on www.temos-international.com, then you find us and the application form. We do have a contact form on the website, also on the front page, on the home page. And we are on social media, so we are on Instagram, Twitter, LinkedIn, and Facebook. Very easy to find. And also messages, of course, can be sent via our social media channels.
Well, thank you very much, Claudia, for finding the time in your very busy schedule for this very brief but very insightful interview. And I'm sure you could enlighten all of us about IVF and how Temos contributes to that very important industry. Thank you very much for your time.
Thank you very much for your excellent questions. It was a pleasure. Thank you.